back live at the GuideWell Insights Lounge. My name is Kate Warnock and we're here at day 2 of Singularity University's Exponential Medicine. And I'm delighted to have two esteemed guests here at the Insights Lounge, Dr. Lucien Engelen and Mr. Paul Smits. Welcome both of you to the interview.
Thank you very much.
Thank you.
Oh, you're welcome. Thank you so much for joining us here.
Actually, Paul is the doctor.
Oh, I'm sorry.
No problem.
Sorry. Paul is the Dean and Vice Chair of Radboud University Medical Center. So I want to start first with you, Lucien. I know that you came with a very personal mission. You have a clearly stated purpose in life, as you put it. I was hoping that you could kind of define for our audience what that is and how you find coming to a conference like Exponential is helping you really make that a reality.
Yes, thank you very much. We really do think that the balance, how innovation is being done within healthcare, somehow has to be rebalanced. We took the approach over the course of the last decades to innovate on behalf of the patients themselves, without even questioning them into it. So one of the things that we're doing right now is that we ask patients what their needs would be in terms of innovation and design the steps carefully together with them right from the very first time. And when I say patients, I mean actually patients, family, and informal care, because that's the actual setting for it.
Let me stop you right there. I have to ask, do you provide boundaries that they can kind of provide those responses within, or is this really a truly open-ended where you're just trying to gather what is it that the patient needs and how do we then build a program around it?
Well, the thing that we actually do in the Innovation Center is that we take exactly that approach, that there are no boundaries in the questions that they can put on the table. There are boundaries in the solutions that we build in the end of the day.
Sure.
Because together with professionals, together with patients, and in the end of the day also with payers, for instance, we have to come up with a solution that's really balanced. So it's an and situation and not or.
Okay, all right, very good. So I know that you are both here from a very long ways away,
Yeah.
but you're here back at Exponential Medicine. I was hoping, what is it that you specifically, Paul, would like to speak to that you want to get from this conference?
Well, for me it's very important that this conference is so much in line with the mission and the strategy of our Radboud University Medical Center. And what I have learned here is that it's the right direction. So this morning there was some evidence that this innovative methods really work and really reduce disease burden. So it confirms that we, as executive board of the Radboud University Medical Center, are on the right track. And that's very important for us.
So it's good validation.
And the Netherlands, I guess, and our institute is a very nice institute to make it happen. It's a good test laboratory as an academic hospital, and a hospital which is in for innovation, and also the Netherlands is an ideal country to make this happen.
So Paul, I was hoping maybe for our audience who may not be familiar with Radboud, can you give us a little history, a little sense of the size of the hospital system that you help to manage?
Well, Radboud University Medical Center is a university medical center which is a merge of an academic hospital and a faculty of medical sciences. Okay. So with one board instead of in the American way where it's two boards, so integration of research, education and patient care. It's 10,000 co-workers, 3,000 students more or less, and I guess 800 beds, something like that. Okay. And it's one of the 8 university medical centers in the Netherlands. And as a university medical center you cooperate with all kind of other hospitals in the neighborhood, in the region. But of course on research and education and patient care we've also an international agenda. Very and therefore we are here and we are networking with other institutes.
You know, so we're delighted to have that international perspective. I know that that's one of the reasons why GuideWell wanted to be here, is to learn what's happening around the world so that we can really help amplify the solutions that we might bring to market too. Lucien, I had a question for you specifically. You as the center director must have a number of challenges that you're hoping to solve. What is your team working on right now?
So I think the main objective and the main change that we need is that all these kind of technologies are already out there. And a lot of stuff and a lot of questions are being posed in terms of, is there any evidence for it already? And like Paul just said, the evidence is gaining right now.
Yeah.
In a lot of other areas, there's evidence for 50 years or maybe even longer already. But the thing is that people start looking at the evidence that's out there at present, and those will be the next steps that we should take into it. The other challenge is to create the awareness of people that the change is needed, so create a sense of urgency. That's also the rationale for us to, again, for the third year in a row, bring 45 people from the Netherlands in one group. And as we've seen already, there's also 2 other groups from the Netherlands at this very conference to get the information, to get the feeling of it, and then back home start really working at it. So it's about awareness, and the other thing is that to really create evidence for it.
You know, I had another question for you. You know, as far as your discovery process, you say that you go out and you speak with your patients, and you really want them to define what problems there are to solve. What is your feedback mechanism to show them that these are the solutions that we built based on your input?
One of which is the adoption rate. Because in the end of the day, it's all about the adoption.
Right.
So, and that's exactly where a lot of the e-health projects up until now kind of failed. Because somebody out there from industry or whatever physician thought it was a great idea to create this program for it and not incorporate the vision of the patients. Mm-hmm. So the approach that we have is to incorporate the patients right from the start. So they are building their own solutions.
Yeah.
With that, the uptake on the adoption rate is much higher.
And just measuring patient satisfaction and participation. Yeah.
Absolutely. So I think, you know, what you've really systematically programized capturing the patient voice. And that's something that, you know, I know in social media, I know, Lucien, you're very active in social, that the patient experience, the patient voice, we really do need to scale it. And it seems like you have captured a process and made a way to make that really happen and tangible. Yeah.
Isn't it strange?
And not only in patient care, but also in research. Starting, and Lucien touched upon this subject this morning, but also in education. So he also told that the curriculum for medical students is built together with patients' perspectives. So in the 3 core tasks of our University Medical Center, we have the patients included principle.
That's phenomenal. So again, you know, as someone who's very engaged in social media, you know, MedEd is a constant conversation, and you know, people like Rishika Fernandopoulos, you know, physician, CEO of Iora Health, has mentioned the chasm that seems to exist in medical education, where they're taught one thing and their practice is entirely different. So again, incorporating that patient right into the curriculum and designing is just a phenomenal model that you've built. So, you know, you are the perfect experience, or the perfect guest to have on here at the Insights Lounge, and really hope that we can take your content and really share this widely, because you bring such a fascinating perspective. And I really appreciate you both sharing your time with us here today.
Thank you.
So, my name is Kate Warnock.
Mutual.
We're delighted to have had you here on the Insights Lounge. We will be back again soon with another live interview.
Thank you very much.